Hello guys, this is Dr. Ajinkya here. Today I'll be talking a lot about the MRI scans. So today I'll be reading the MRI brain and the MRI parietal sinus, that's the MRI PNS. So I'll also be talking about what exactly questions the examiner may ask for an exam going student for a postgraduate or in MBBS. So if they are asked a lot of questions about the MRI scans like spotters, so what questions do they exactly ask and where do you need to be very efficient in answering the questions? And so basically I'll be clearing up the anatomy of the MRI itself, the different types of MRI, the FLAIR sequence, the diffusion weighted sequence, everything I'll be talking about in detail about the MRI scans, and also how you can actually locate the internal carotid artery pathway, also the posterior circulation of circular willis. Everything I'm going to be talking about on this video on these particular MRI scans. So I hope after watching this video your basic concepts in MRI is very much clear. Also I'll be talking about the various sequences, the T1, the T2, the post-contrast T1, the axial, coronal, sagittal sections. So basically the entire MRI brain, not the entire aspects, but the most aspects of the MRI brain and the MRI PNS I'll be covering up in this video. So let's begin. So to start with, first of all, I would like to explain about the sequences of the MRI. So basically, as you know that there are two main sequences of the MRI, which is the T1 and the T2. So first I'll be talking about the T2 sequence because it will be very easy for you that way. So as you can see on your screen right now, so whenever you are given an MRI scan, now I have made a video previously which states how you can actually identify and differentiate between a CT scan and an MRI scan. So you can go onto my channel and have a look at it. So moving on. So the T2 sequence. Now we should remember that T1 is the anatomy and T2 is for the pathology, right? So T2, how you can identify like a spot on. So if the examiner gives you a MRI scan and asks you which sequence is this. Now if you get a scan like this, it's definitely you have to be giving the answer as T2, because whatever body fluids in the body, they appear as bright white on the MRI scan T2 sequence. So as you can see over here, this is the most anterior aspect of the MRI. The bone will appear black. So as you can see, this is a frontal sinus over here, and you cannot see the bone lining. So the air and bone will appear as black on MRI scan. No matter which sequence it is, it will always appear black, the bone and the air. The soft tissue, however, will appear bright white or the gray, depending on the sequence you're using. So this is a frontal sinus over here, and you can see it's normal because there is no any collection within. It's completely filled with air on both sides. So they may even ask you locate the sinuses, where the sinuses may be on an MRI scan as well, rather than not on the CT scan too. So you have to see for the eye globe. So in case of a PNS or MRI brain, you have to see for the eyeball. So if the eyeball appears as this, two bright balls, you can see the lens over here. The lens will appear as opaque, and you can see this fluid. So this fluid is basically nothing but the aqueous and the vitreous humor in the eyeball. So once you start seeing the eye like this, it is definitely a T2. That is one point. Now the second point is that if you want to see a scan of T1, now as you can see over here, that's the same patient, same scan, but a different sequence. As you can see, it is no longer bright white, it is grayish in color, blackish gray in color. So it is iso-intense to the muscle. So as you can see, it is, you can say it iso-intense or a bit hypo-intense to the muscle over here. You can see the muscles over here, the eye globe. So this is a T1 scan. Okay, this is a T1 scan. You can always remember it like that. It's a T1 scan. Now sometimes what happens that you also get a T1 scan post contrast, where you use a gadolinium contrast in the patient. So In those cases, you can see the blood vessels in the brain flaring up. So you can see here the brain parenchyma. You can actually localize the sulci and the gyri and the gray matter and the gray matter and the white matter in the brain. So always look for the CSF as well. And once you locate the ventricles in the brain, you can see that these are the two lateral ventricles. So these are the ventricles, they also appearing as gray. So this has to be a T1 scan. So I was showing you a T2 scan sometime before. So if I go and localize the ventricles, you can see here they are bright white. So that is nothing but the CSF. So you have to localize these two areas to know whether it is T1 or T2 is for the CSF and the eyeball. So that is about the T1 and T2. Now about the T1 post contrast. Now this is T1 for sure. Now had it been a T1 post contrast, the brain would have shown a lot of blood vessels flaring up. It would have been the same thing like this, but the muscles would have appeared as bright, because muscles have a lot of blood supply, and if you give a post contrast to the patient, the muscles tend to sometimes flare up, so the muscles will also appear as bright white. And also you can see a lot of flared up blood vessels in the brain. So in some time I'll show you a T1 post contrast somehow. So I'll try to show you a T1 post contrast in some time. So this was about the T1 and the T2 basic sequences. And moving on to the further scans, we all know that after T1 and T2, T1 post contrast, we have the FLAIR images. We've got the diffusion weighted images. Now what is a FLAIR and what is a diffusion weighted image? So if an examiner asks you if you have any idea regarding the FLAIR and the diffusion weighted, just remember that the diffusion weighted appears to be as a very hazy picture. We also have the FLAIR image. Now FLAIR image is nothing but fluid attenuated inversion recovery. So it is nothing but a T2 scan. Now I showed you a T2 scan, right? Remember? Let me just reopen that page over here. Yeah, so this was a T2 scan, remember? So the T2 scan is not that FLAIR is nothing but the T2 scan, but as the name suggests, it's fluid attenuated. So the CSF and the eye globe will be attenuated. So each and every feature of T2 will be present, except for the fact that it will not appear as bright white, that is the CSF and the orbit. It will not appear as bright white. So I'll be posting a picture at the end of this video, so as to for you guys can have a summarization of all the features of T1, T2, FLAIR, diffusion weighted images, T1 post contrast. So how does the spinal cord, the CSF, the vertebrae, the base of skull, the brain, the sinuses look like on the T1, T2 and various sequences. So I'll give you a tabulation form photograph at the end of the video. So keep watching the entire video to get the concepts very much clear. So this was all around about T1 and T2 and various other basics of other sequences. So the most important thing in an MRI is to know certain basics, certain structures, how they look on the MRI, and which sequences is much better for which condition. So for example, if I try to show you over here, if I take an example of CSF, as I showed you, T1 has dark, T2 is bright, FLAIR is also dark. If I take the white matter, if I consider the white matter in the T1 scan, the white matter in the T1 scan, now let me just give you a view of the T1 scan over here. So this is the brain in T1 scan. The white matter in the T1 scan is light, so it will appear as light. As you can see over here, this is a parenchyma of the brain. The white matter, it is kind of light, it is not dark. So always remember, the T1 weighted image, the white matter will be always light, and if you consider the T2 weighted image, the same thing will appear as dark gray. Now the same thing which my cursor is pointing out here on T2 will be appearing as dark gray. Now as you can see, same thing, see, this is T2 confirmed, and the same thing, the white matter is now appearing as dark gray. So this is a basic difference you need to understand about the brain parenchyma. That's the white matter and the gray matter. If you know about this, if the examiner gives you any scan, and I'm sure that you guys will be able to answer the correct question, or you can say you can answer correctly. So that was about the white matter, and as you can see, the cortex remains gray in mostly roughly in the both scans. It's like it stays gray in both the scans, that is T1 and T2. The cortex, that is the outer part of the brain, it stays kind of grayish in both the scans. It may be normal gray in T1, so this is a T1. It may be normal gray in T1, but in T2 it may be light gray, so it is like a lighter version of gray towards the brighter side. So that is the only difference in the cortex part. Now, say for example, if the patient is having a trauma, a head trauma, and he has some kind of loss of consciousness, or he's semi-conscious, if he's having brain inflammation. Now remember, listen carefully what words I'm using right here. If he has inflammation in the brain, then just remember the inflammation is always dark on T1. So this is a case of T2, right? So if it is a T1 scan, as in this case, if the patient had any trauma, had the patient been having any trauma here, the inflammation in the brain, say for example any infection or demyelination or anything, would appear as dark on T1 and bright on T2. So same thing. So the inflammation part is dark on T1 and bright on T2. So this is how a radiologist can identify how the patient is having a inflammation or not. So rounding up the basic differences. So if you have the patient has any surgery, if he undergoes a surgery, say for example a CSF leak repair, or if he has any herniation of brain, so through the skull base defect. So once you do the surgery and when you get a post surgery, now this is for the ENT and skull base surgeons who is watching this video. So if you get a post-op scan in 36 hours, and normally it takes for a patient, you should normally do a post-op scan 36 hours after the surgery for the CSF leak. So you can see that whatever you have repaired, the fat, you will have to visualize the fat and the CSF leak. So the fat appears as bright on T1. So this is a T1 scan. If you had a surgery over here, the skull base, the fat will appear as bright white on T1. Always remember that. And it will appear as light, less bright on T2. So it appears bright in both the scans, unlike the inflammation, that is meningitis or an infection. It appears as T1, it appears as on T1 it appears as dark, and T2 it appears as bright, but the fat will be bright on both the scans, T1 and T2. So these are certain basics of the MRI. Now similarly, you cannot see bone on MRI. As you can see over here, you can see that's the brain. You can see that's the globe, that the orbit. You cannot see a single bone. What you can see is a thin black rim over here. So do not confuse that black rim with the air column, but that is nothing but the bone. So this is the skull base right here. So the skull base surgeon should be very much keen on looking for the area if any skull base surgery prior to any CSF leak repair. So this is a skull base bone which seems to be pretty much intact in this region, and you can see something bright white over here. Yeah, you can see something bright white. This mostly seems to be the olfactory bulb, the olfactory tract. This is supposed to be the olfactory tract or the olfactory bulb because it's in the anterior aspect over here. These are the turbinates. Now the turbinates or any fluid or any retention collection in the maxilla or frontal or in sphenoid sinuses. For example, I'll show you over here. Now just let me show you a axial scan of this patient over here. So as you can see, this is a T1 scan because the CSF in the orbit is not bright. So if you take a look at this scan and in the sphenoid sinus, you can see a collection over here in this region. So any collection or any fluid retention cyst or polyp appears to be as bright white on T2 and hypo illuminating, or you can say hypo intense to the soft tissue in case of T1. So any fluid will be hyper intense on T2 and hypo intense on T1. So this is a collection in the right sphenoid of this MRI scan, the right posterior ethmoid. So this is how you get to know the basics in MRI. So this is winding up the basics of the T1, T2, post-T1 contrast, FLAIR, diffusion weighted images. Now moving on to also the basics of how you can see the bone, the air, the fat, the inflammation, the gray matter and the white matter on the different scans and sequences. Now what I want to show you guys over here is how, if at all, you get a patient's MR venography done. So for example, you want to know the status of the blood supply in the brain, you do an MR angiography, you do a MR venography. So I have a MR venography for you guys where I can teach you the entire anatomy of the dural venous sinuses in the brain out there. So before that I'll teach you the anatomy of the dural venous sinuses. As you can see over here, this is a sagittal section. This is a sagittal section of the brain, and as you can see over here, now what is a dural venous sinus? Now it is nothing but the pooling of blood. Which blood you say is a venous blood? The venous blood pulls around in between the two layers of dura mater, that is the meningeal layer and the periosteal layer. So between these two layers, you can see the dural venous sinuses. So the very superior aspect, you can see the superior sagittal sinus, as the name suggests, that's the superior sagittal sinus. Then if you go inferiorly, you can see over here the inferior sagittal sinus. Now listen very carefully, guys. The inferior sagittal sinus, as you can see over here, it meets with the great cerebral vein. Now the thing which you can see over here poking outside is nothing but the great cerebral vein. The inferior sagittal sinus unites with the great cerebral vein and forms the straight sinus. Okay, now many guys have seen, now I have taken examinations before in past. I have worked in institutes in Mumbai, so I know, I have taken exams, so I have asked this question to the students. Now many students get confused between the straight sinus and the transverse sinus. These two are different things. Okay, so as you can see over here, the thing which is formed by the union of the inferior sagittal sinus with the great cerebral vein is the straight sinus, and this straight sinus meets with the superior sagittal sinus posteriorly over here to form the confluence of the sinuses. So this is the place where the sinuses meet, and this continues as the transverse sinus, as you can see over here. So this is the transverse sinus, and this transverse sinus continues inferiorly. The bend you can see over here, that bend is the sigmoid sinus, which a normal ENT surgeon normally encounters with in lateral skull base surgery and a normal mastectomy surgery. So this is the sigmoid sinus over here in the mastoid bone, and the sigmoid sinus gets two connections. You can see over here, this is a superior petrosal sinus, that is the inferior petrosal sinus, and these meet about here in this region and they eventually drain into the internal jugular vein. So this is the anatomy of the the dural venous sinuses. So I hope this is pretty much clear to you guys now. So the same thing, it's okay, you know the anatomy, but how if in the examinations, if you are given the MR venography as a spotter for your practical exam for all the postgraduate students, be in ENT or neurosurgery. So if they ask you the MR venography, so I'd like to show you how these same structures look like on the MR and venography. So this is, I have a MR venography of a patient. This is the same sagittal scan. Now I'd like to show you, I'll compare these two images together so you can have a much better view. So I hope this is much better now. So as you can see on the image over here, this image showing sagittal section, this image is showing the sagittal section. So it's actually a mirror image of each other. So as you can see, this is a superior sagittal sinus. Same thing over here. This is a superior sagittal sinus over here. Same thing you can see over here. That's the inferior sagittal sinus. That's the inferior sagittal sinus. Though it is not straight in this case, but you can visualize the inferior sagittal sinus over here. And you can clearly see the great cerebral vein over here, and they're forming together. You can see over here, that's the straight sinus. You can clearly see the straight sinus here. So it is very clear on an MR venography. Superior sagittal sinus, inferior sagittal sinus, the great cerebral vein, the straight sinus, the confluence of sinus you can see over here, and you can see the transverse sinus very clearly over here. So you can just have this mirror image over here. That's the transverse sinus, and that's the transverse sinus over here. It continues together to form as a sigmoid sinus. Similarly, as you can see, exactly the same shape. You can see that's the sigmoid sinus. You can see the sigmoid sinus over here, and you can actually see the superior petrosal sinus, the inferior petrosal sinus, and then eventually this is going to form the internal jugular vein. So this is how you see an MR venography if asked in the examinations. So I'd like to show you a different view on this. So this is a front view. As you can see, this is a superior sagittal sinus, as you can see from the anterior aspect. As you can see over here, the patient is having a transverse sinus, and the transverse sinus the patient is having, this is the transverse sinus over here. On the right side, it is very much intact, but on the opposite side, I think the transverse sinus is not even present. So it's completely almost obliterated. The transverse sinus is obliterated. You can see the internal jugular vein over here. That's the internal jugular vein. So this is how you read an MR venography very professionally. So even if you're a student, if you read this very carefully, if you watch this video, if you learn from authentic books, I'm so sure that your concepts are going to be very, very easy. So for the MBBS students, they can always refer to the BD Chaurasia anatomy. If you're a postgraduate student in skull-based ENT, you can always refer to the skull-based books. If you're a neurosurgeon, definitely you can refer to the skull-based books of your surgeries. So once you clear this anatomy, I think any examiner will be impressed with the answers you give. So this is about the venography on the MRA. And the next thing is I would like to talk about is how you can actually visualize the internal carotid artery on an MRI scan. So it's not necessary that you do an MR angiography as such to visualize the ICA. You can do that on normal MRI scans as well. So let me show you one MRI scan of another patient over here. So yeah, this is actually an MR cysternography which I had done for a patient of mine, but she had a suspected CSF leak. But so I'll give you a rough idea of how the internal carotid artery looks like over here. So so this is an axial scan. You can see this is a T2 weighted image. You can see that's the bright aqueous, the eye liquid. So the aqueous and the vitreous humor actually. So that's the T2 scan. Now there are two things if an interventional radiologist is giving you an MRI scan or a normal radiologist is giving you an MRI scan. See, the MRI scan, if the patient is having a T1, the artery will be looking as a flow void over here, so like a empty black vessel. If it's a T2, same. If you think that if the patient is undergoing a contrast enhancement, that the artery will brighten up or it will illuminate, no, it is not like that. Now there are two things in that. Normally a radiologist gives you a superimposed radiological scan wherein the contrast once the contrast is injected into the bloodstream, it takes some time to go into the blood vessel and into the brain. So now a professional radiologist can give you an idea about what the time exactly is, but it's like within within few seconds to minutes. So once you get a T2 scan, or you can take a T1 post-contrast scan, normally the blood vessels, the veins in the MRI scan fill up, but if it's a superimposed MRI scan, the internal carotid artery or any artery, normally the big vessel will be shown as a flow void, because it's a superimposed scan, or that they scans very rapidly. So because of the high velocity or the high blood flow, the scan cannot pick up the blood flow, so it appears to be as a flow void. So it appears as an empty channel or empty blood vessel, as you can see over here. That's an artery. That's actually the middle cerebral artery, so in the brain. So it appears as a blood flow void. So I'll give you a basic about the blood vessels. Now I am so sure that you must have read about the circle of Willis. If you haven't read about the circle of Willis, I have another video about it, which where I've explained in detail how you can actually draw a circle of Willis and what are the parts of it. So you can go to my channel in the link, or I'll give you a link in the description below for the video. Also, if you want to read or go through a lot of skull base books, I have all the links in the description panel below, so go check it out. So as you can see over here, now this is an axial section, and as you can see, this is the cerebellum over here. That's the cerebellum. You can see these two dots over here. You can see these two flow voids. Now you can see these two flow voids, the vertebral arteries. Now you know that the vertebral arteries on either side unite to form the basilar artery. The basilar artery above will end and give the superior cerebellar artery and the posterior cerebral artery, right? And then the posterior cerebral artery communicating with the middle cerebral artery, with the posterior communicating artery, and so on. So as you can see over here, these two flow voids are nothing but the vertebral arteries on both sides. As I keep going up, now see, as you can see, the scan is moving and I'm going up. So as you can see, there's one branch over here. The branch is coming over here. Okay, so it is actually trying to communicate from each side. Now we all know that the vertebral artery has a branch which is called as the posterior inferior cerebellar artery, which we normally call as PICA, P-I-C-A, PICA. So you can actually see a PICA over here. So this is a main vertebral artery over here, and if you look carefully enough, you can see a branch over here, right? It's very faint in this scan though, but you can see a branch over here inferiorly. That has to be a PICA. That's the posterior inferior cerebellar artery. So as you go above these two vertebral arteries, I can see they're combining to form a basilar artery. So this is a basilar artery over here. Now as the basilar artery goes above, up to a certain level, the basilar artery will give a branch which is called as the anterior inferior cerebellar artery, which is also called as the ICA. So you can actually see the ICA being coming over here. So the inferior aspect of the basilar artery will have ICA. So you can actually see this is a union of the base. As you can see, a branch is coming off over here. You can clearly see a faint branch is coming over here. You can see that. I'll just zoom it for you guys. So as you can see over here, that's a faint branch coming. You can actually see that. That's the anterior inferior cerebellar artery. As you keep going up, at a particular level, it will start giving one more branch over here. As you can see over here, it is giving a branch. You can see a branch over here on either side. You can clearly see two branches going over here on either side, that is nothing but the superior cerebellar artery, and immediately above you will see one more branching, which is nothing but the posterior cerebral artery. So you could see this level is a superior cerebellar artery, and if you keep going up you can see one more branch coming off here, which is nothing but the posterior cerebral artery, which is a posterior cerebral artery, okay, which is a posterior cerebral artery, you can see over here. And then the basilar artery ends and then divides into the posterior cerebral artery. So you can see the posterior cerebral artery over here. Now that's the posterior cerebral artery coming into picture, and the posterior cerebral artery, through the help of the posterior communicating artery, as you can see over here, goes and joins with the internal carotid artery, which you can start seeing over here. Now this is the area of the orbital apex, and this is the area of the lowermost aspect of the sphenoid sinus over here. So you're coming from below to above, so that's the internal carotid artery, almost at the level of the inferior aspect of the sphenoid sinus. That's the orbital apex, you can see. So as I keep going up, you can see this is the artery over here. You can see this is the artery over here, and that's the internal carotid artery. And sometime if I keep going up, if I keep going up, see, we were here, right? This is the basilar artery dividing into two posterior cerebral arteries. You can see over here, these two are the posterior cerebral arteries, and then you can see the posterior cerebral artery going up, and you can see over here, that's the middle cerebral artery originating. That's the internal carotid artery. You can see the optic chiasm over here. That's the optic nerve right side, that's the optic nerve left side, and that's the optic chiasm you can see over here, and that's the internal carotid artery. That's the internal carotid artery, and you can see the middle cerebral artery originating from there. So that's the internal carotid artery giving off an MCA right there. Now that's the middle cerebral artery. That's the middle cerebral artery over there, and this middle cerebral artery is going laterally into the sylvian fissure. Now that's the sylvian fissure over there. That's the sylvian fissure. So the middle cerebral artery goes into the sylvian fissure, and then it goes first anteriorly, curves posteriorly, and then gives a lot of branches over here. You can see a lot of branching. That's the middle cerebral. A lot of flow voids you can see over here. Just keep on following the cursor, the red cursor. You can see the branches of the MCA. These are the branches of the MCA. You can see a lot of flow voids, small flow voids over here. These are all the branches of the MCA, the middle cerebral artery. So that was the middle cerebral artery. So that's the MCA. Now this is the optic chiasm. Now this is the anterior cerebral artery, ACA. Now this is very important, guys, especially for the neurosurgeons and the skull base surgeons. This is very important, so listen very carefully. So this is the A1 part of the anterior cerebral artery. That's the A1. So A1 is nothing but the origin of the ACA, from the ICA to the anterior communicating artery. Now you can actually see this is the ACA of the right side, this is the ACA of the left side, and what you see, a small horizontal line here, you can see that, that's the anterior communicating artery. So this up to the anterior communicating artery from the ICA, you can call this as A1 segment. Above the ACOM, you can call this the A2 segment, and you can clearly see the MCA over here. That's the MCA from here. That's the MCA. That's the MCA, sylvian fissure. And if you keep on going above towards the apex of the skull, you can see this is a right ACA. This is a left ACA. This is a right. This is a left. That's the sylvia. That's the falx cerebri center midline. You can see the two ACAs very clearly and above. So here it divides into all those branches of recurrent artery of Hubner, then the frontopolar artery, then the so one is the recurrent artery of Hubner, the other is a frontopolar artery, and there are many more branches as well. So that's the frontopolar and the frontoorbital artery. So 3 branches the ACA gives from the A2 part. Okay, so this is how you can identify the blood vessels on an MRI scan. So what have I taught you so far is the basics in the MRI brain and the PNS, the various different sequences and the windows. I've taught you the MR venography, the anatomy of the dural venous sinuses, how the sinus network is formed, which sinus leads to another. Because trust me, many students do not know at the level of PGs as well. They in the exam do not know how the sinuses are actually formed. So I hope this is very clear to you. Also, I showed you the vertebral artery, the circular willis, the MCA, the ACA, how it looks on an axial scan. The same thing you can follow on the coronal scan. You just have to see for the flow voids. I'll just give you a quick look at the internal carotid artery on the coronal section. So as you can see over here, normally an ENT surgeon or a skull base surgeon or a neurosurgeon will look for the area of the skull base, and they directly will look for the carotid arteries over here. Now what you see in front of me, or you can say in front of you guys, this white bright structure is nothing but the cavernous sinus. This is the right cavernous sinus, that's the left cavernous sinus, and that's the superior intercavernous sinus, inferior intercavernous sinus. That's the pituitary stalk somewhere over here. You can see very easily. Yeah, that's the pituitary gland over here. Very clearly you can see that's the pituitary gland. So I'll show you again. That's the pituitary gland. That's the pituitary stalk over here. These are the 2 lateral ventricles. If you go posteriorly, you can see the 3rd ventricle over here. So you can start seeing the 3rd ventricle, and yeah, that's the 3rd ventricle. You can see 2 ventricles, the 3rd ventricle. So if you want to look for the carotid artery in this section, you always, now that's the optic chiasm. Okay, that's the optic chiasm. So that's the optic nerve, right optic nerve, left optic nerve combining to form the optic chiasm. You can see the carotid artery lying just inferior lateral to the optic chiasm. Now I have posted a lot of skull base surgery videos so for the anatomy, so where I've easily taught you guys that the internal carotid artery is always inferior lateral to the optic chiasm. So always remember that in the cavernous, this is a sphenoid sinus, remember that. Now that's the sphenoid sinus. Laterally you can see the temporal lobe over here, that's the temporal lobe, and that's the sphenoid sinus. You can see the carotid artery on the superior lateral aspect. Now the carotid artery in the cavernous part will have 2 flow voids, as you can see here, one above and one below. You will always see 2 flow voids on either side. That is nothing but the same internal carotid artery having a curvature from posterior to the anterior, and that is why at the same cut section you can see the 2 flow voids of the same carotid artery, internal carotid artery within the cavernous sinus. This is called as the cavernous siphon. The siphon is nothing but the curvature of the anterior genu and the posterior genu of the carotid artery in the cavernous sinus. So this is how you can locate a cavernous sinus carotid artery. Now I'll be making a separate video altogether of the internal carotid artery, where how you can see it on an arteriography, MRI, CT, as well as the entire anatomy, clinical anatomy of the carotid artery. So I think this is it. So if any PG student or any skull base surgeon or a neurosurgeon is watching this video, or any MBBS student is watching this video, I hope all the concepts of the MRI are now clear to you. If you have any doubts, any questions, please feel free to post comments. I will always reply to them. Okay, so whatever doubts you have, whatever you want to learn in future, which you do not get to learn from your college, do not worry. You can just comment in the section below, and I'll be always happy to help you guys. Okay, so until next time, see you soon, take care, thank you.